Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. I'm Dr. Naji. Today I'm going to demonstrate the nerves and vessels of the lower limb. It means our practical session today, two parts. First part about lower limb nerves, and second part, inshallah, about lower limb vessels. This is the introduction to remind you that as you know, all the spinal nerves are coming from the spinal segments of the spinal cord, and as you know that the spinal cord have 33 segments. This symbol model to demonstrating the segment and organization of the spinal nerve. So this model shows the spinal segment. This is spinal cord, spinal segment. The organization as it consists of firstly or at the beginning at rootlets and two parts or two rods: ventral rod or anterior rod, dorsal rod or posterior rod, and joining each other to form the spinal nerve trunk. And the spinal nerve trunk comes out through the intervertebral foramen to bifurcate like this, to bifurcate into two rami. Ventral ramus goes to ventrum of the body, dorsal ramus goes to the back of the body to supplies the muscles of the back, while the ventral ramus to supplies all the structures, organs, and the muscles as well in the ventrum of the body. So, also the nerve supply of the lower limb is coming from two plexuses. First one, lumbar plexus, second one, sacral plexus. Lumbar plexus are the ventral rami of L1, L2, L3, L4, while the sacral plexus are it's the plexus or the network, the ventral rami from L1 into L4 to S4 are joining each other to form the plexus, and from these plexus there are branches to supply the whole part of the lower limb. So we'll start with the lumbar plexus and then sacral plexus. So we'll start with the lumbar plexus. As you know, practically we need to know, or we need to identify or to demonstrate the structure rather than talking about the information, related information. I know that the lecture have been delivered by my colleague, and they explained all the information about the structure. So today I'm directly going to demonstrate or to identify and how you could differentiate between these structures. All right. So about the lumbar plexus, as I said, route from L1 into L4, ventral rami of L1 to L4. Then the branches are related to psoas major muscle. This is the psoas major muscle, one of the posterior abdominal wall muscle called psoas major. So the nerves of the lumbar plexus are related to this muscle. So we have some branches on the lateral side, like this one, and we have some branches in front of this muscle, like this one, and we have some branches in medial to this muscle, like this branch or nerve. All right. So about each one of them, firstly, I'll start with the branches which locate in right border or right side to this muscle or medial to this muscle. Firstly, this one. This one. It's called lumbosacral trunk. Lumbosacral trunk. It comes from L4 and also L5 as well, and descending downwards to participate in the formation of sacral plexus. That's why it's called lumbosacral trunk. This is the first. Second, obturator nerve. This one, obturator nerve. How could you know that? Because it passes through the obturator foramen. زي ما هنشوف على موديل تاني هنلقاها إنه هي passes through the obturator foramen to supply the medial compartment of thigh. So this is the obturator nerve. In front of the muscle, this one, it's called genitofemoral nerve. Genitofemoral nerve, and bifurcate into genital branch medially and femoral branch laterally. Genital branch, femoral branch. Then about the nerves which locate lateral to this muscle or in lateral border this muscle from upward downward, the first one is subcostal. And as you know, subcostal, it comes from T12. Okay. طيب ليش حسبناهم؟ لأنه because of area of innervation، لأنها هي والباقين اللي حنشوفهم بعد شوية supplies the anterolateral abdominal wall. فعشان كده in order to differentiate among them فنذكرها في البداية. فسبكوستال واحد، اثنين إليو هايبوغاستريك and إليو انجوينال. إليو هايبوغاستريك فوق. Okay, this one, and إليو inguinal, this one. All of them are coming from L1. Then also we have lateral cutaneous nerve of thigh. أنا أشوف إنها هي ما هي موجودة هنا بس موجودة على another side. أوكي حتى هي برضو هنا removed، ما هي موجودة anyway. Lateral cutaneous nerve. And then the biggest or the largest one, it's the femoral nerve. Femoral nerve. So from upward downward, subcostal, iliohypogastric, ilioinguinal, lateral cutaneous قلنا removed, and then femoral nerve. As I told or as I explained before, in the lumbar plexus, one of the structure was removed over there, but is very clear over here. This one, it's called lateral cutaneous branch of thigh. It passes in front of anterior superior iliac spine, so supplies the lateral area of thigh. This one. And also it supplies the upper lateral quadrant of buttock. Okay, lateral cutaneous nerve of thigh. Okay, also about the obturator nerve, it's very clear also over here. It passes through the obturator foramen. So this is the obturator nerve. Okay, regarding the sacral plexus, as I explained, the sacral plexus, it's the plexus or the network of ventral rami from L4 into S4. This is the very clear over here, ventral rami from L4 into, as well as the sacral nerves or segments in front of the piriforms. This is the piriforms. So beginning of or the sacral plexus in front of the piriforms, related to the piriform. Okay, about the branches of sacral plexus are emerged through the sciatic foramen or sciatic foramen. And as you know that the piriforms as well, it passes through the sciatic foramen. So there are some branches passes above piriforms and some branches passes below piriforms. So the regarding the branches which passes above the piriform is only one. This one, it's called superior gluteal nerve. Superior gluteal nerve. As you know, the superior gluteal nerve supplies gluteus medius and minimus. Then about the branches which passes below piriforms, arranged from lateral medially. The first one are the largest nerve in the body. It's called sciatic nerve or sciatic nerve. It composed of two portions or parts: medial part, tibial part, lateral part, common peroneal or common fibular. Then inferior gluteal, this one supplies gluteus maximus, and then posterior, this one called posterior cutaneous nerve of thigh, and then it's supposed to find the nerve to obturator internus, but unfortunately removed or not clear in this model. Then nerve to obturator, nerve to piriformis muscle. This model shows nerve to piriformis muscle, which supplies piriforms. This is the piriforms, very clear. And the sciatic nerve or sciatic nerve start just below it. So it seems like key to identify or to demonstrate the sciatic nerve. So this is the nerve which supplies the piriforms. It's called nerve to piriforms. And then we have pudendal nerve, the last one or the most medial one. It's called pudendal nerve. This one. It emerges through the greater sciatic foramen and goes inside again to the pelvic cavity through the lesser sciatic foramen. Okay? So most medial one, it's called pudendal nerve. And the pudendal nerve also it has three small branches. The first one over here, it's called inferior rectal nerve. Inferior rectal nerve. Then from posterior, the arrangement of these three branches of pudendal nerve from posterior ventrally or anteriorly. The first one, this one, it's called inferior rectal nerve. Then perineal nerve. Then the most anterior one over here, it's called dorsal nerve of the penis or clitoris. This one. Bismillahirrahmanirrahim. This is the second part of our practical session today about lower limb vessels. So we'll start with the artery and then veins. The artery, the first or the main arterial source of the lower limb is the femoral artery. And as you know, the femoral artery, this is the femoral artery. As you know, femoral artery, it's a continuation of external iliac artery. This is the external iliac artery, one of the terminal branch of common iliac, and the common iliac is one of the terminal branch of the abdominal aorta. So abdominal aorta, then common iliac, then external iliac, this one, and it passes just beneath the inguinal ligament. This is the inguinal ligament. This is the inguinal ligament over here. This is the inguinal ligament. So it continues as the femoral artery. This is the femoral artery. Femoral artery, this one. So regarding the relation, medial to it, femoral vein, lateral to it, femoral nerve, and as you know, it's one of the content of the femoral sheath as well as femoral triangle. And do you know the difference between them? Content of femoral sheath, femoral canal, femoral vein, femoral artery. While content of femoral triangle, canal, femoral vein, femoral artery, and then femoral nerve. So in sheath, the femoral nerve excluded. Okay. So this is the femoral artery. As I said, started just below inguinal ligament and descend downwards, as you see, to be ended over here in adductor hiatus. When it pierces this muscle, it's called adductor magnus, and forming foramen or hiatus for the passage of the femoral vessels, femoral artery, as well as femoral vein. So the femoral vessels passes through this foramen. It's called adductor hiatus. It means the course of femoral artery from inguinal ligament to be ended in adductor hiatus. About the branches of femoral artery, most of them are very clear in model number E31. Okay, the first branch, this one, called inferior epigastric artery. The second, this one, it called superficial circumflex iliac artery. And then the largest or the biggest branch inside this, it called this one. Is it clear? It called deep artery of thigh, or profunda femoris artery. So profunda femoris artery or deep artery of thigh. And this artery has a lot of branches. The most important two are lateral femoral circumflex, and medial femoral circumflex. Medial femoral and lateral femoral circumflex. Okay, surrounding the upper part of shaft of femur. And then, as I said before, the femoral artery descending downwards to be ended over here in adductor hiatus. Also, we have a lot of muscular branch as well as articular branch. For example, the artery which supplies the hip joint. Okay. فاللي قلناهم الآن اللي شفناهم الآن هم ال most important ones. This model to show the popliteal artery, and the popliteal artery it lies just behind the knee joint in the popliteal region, and the arrangement of the structure over here, branches of sciatic nerve or sciatic nerve. This is the tibial artery, tibial nerve, while over here common peroneal or common fibular nerve. Then we have popliteal vein in superficial position, then most inside or most anteriorly or the deepest one, this is the popliteal artery. So from superficial deep or from backward anteriorly, sciatic nerve, branches of sciatic nerve, then popliteal vein, then popliteal artery. And the popliteal artery, it shows a lot of branches over here. Most of them it called genicular artery because they are related to the knee joint and making the anastomosis around the knee joint. That's why the branches over here, they called genicular arteries. All right, this plastic model, it shows the popliteal artery and the terminal branch of popliteal artery. This is the popliteal artery. Okay, and the course of the popliteal artery, it will be ended at lower border of popliteus muscle. So at this level, the popliteal artery bifurcate into two terminal branches. The first continuous downward as posterior tibial artery. A second one or second terminal branch is anterior tibial artery. So the terminal branches are posterior tibial, sending downwards, and anterior tibial, this one. The first one, anterior tibial artery, this one, and goes forward above to interosseous membrane and to be in anterior compartment in front of interosseous membrane, and will be accompanied with the deep peroneal nerve. So it descends downwards accompanied to the deep peroneal nerve. The branches are muscular branch, anastomosing branch, which making anastomosis around the knee, as well as participate in the anastomosis around the ankle joint, and then it passes just below or deep to extensor retinaculum over here, to be on the dorsum of the foot as dorsalis pedis artery. This is the dorsalis pedis artery. Terminal branch is the posterior tibial artery. Posterior tibial artery descending downwards, accompanied to the tibial nerve, and passes behind the medial malleolus of the tibia to be reached into the sole of the foot or plantar surface of the foot, and branching or branch or bifurcate into two terminal branch, medial plantar artery accompanied to medial plantar nerve, lateral plantar artery accompanied to lateral plantar nerve. To supplies, both of them are participating in supplement of all structure of the foot. Yeah. Okay, about the vein, due to direction of the blood, so we're gonna start distally and goes proximally. So the vein started from the dorsal venous arch on the dorsum of the foot. This is the site of dorsal venous arch over here and over here, and then the dorsal venous arch ascending upward into two trunk, medial trunk and lateral trunk. Medial trunk in front of medial malleolus as greater or great saphenous vein ascending upward. This is the beginning, and okay, and over here also it's very clear, this great saphenous sending upward to reach into the proximal part of the femoral vein to drain into femoral vein through the great or through the saphenous opening. It's the opening in the femoral sheath. Okay, then laterally. Then laterally, the dorsal venous arch sending upward behind the lateral malleolus as this, as the small saphenous vein. And small saphenous vein, it's very clear over here, this one, sending upward to drain into popliteal vein. To drain into popliteal. Okay, about the classification classification of the veins, it's classified into two parts: superficial veins and deep veins. Superficial veins, the good example of superficial veins are digital and communicating vein in the digit or in toes, as well as the dorsal venous arch over here and great or greater saphenous, as I explained before, as well as femoral vein, also small saphenous vein. Small saphenous vein. It has or accompanied to sural nerve. Okay, while the deep veins are venocomitant of the main arteries like anterior tibial and posterior tibial artery, as well as femoral artery. The venocomitant of the anterior tibial and posterior tibial artery drains to the popliteal vein, while the venocomitant of the deep artery of thigh, which is a branch of femoral artery, drain directly to the femoral vein. That's it. Good luck.